This is Dr. Stanley Lang, and welcome to this broadcast. The sequence that I've been talking about is on how to reduce stress, stress management, how to save your life by stress management, and today we're focusing on physical elements of how to accomplish this task, because we've been looking at how to approach stress management through a whole person health approach, physical, emotional, spiritual strategies that we can do each of us to decrease the damaging and dangerous effects of stress in our life. So today, a question that I have for you is, how does cardiovascular exercise decrease stress? So we've heard that it does, so how does it do that? Well, this is not going to be a detailed um, entry into the biochemistry of stress and how exercise decreases it, but I do want to focus on three different strategies that are part of what I see happening in stress reduction or stress management with exercise. First, a couple of stories. I saw two patients recently who were both men, and both of them were pretty physically fit. And both of them had had a significant decrease in energy recently. Both of them admitted that even though they were still pretty physically active, that they weren't doing the exercise that they'd been doing before. In fact, one of these men had retired a few months ago, and he felt like he would probably be feeling a lot better because the stress of his job was behind him, and he didn't have to worry about his job anymore. But also, his job had been somewhat physically challenging, and so it had been a sort of a natural exercise program for him. It was gone now, and he hadn't started any kind of a discipline of exercise. And one of the things that he was noticing was that he was feeling more tired and was getting winded more easily, doing stuff that he used to be able to do before, and he was blaming this on some other issue with his body. So as we talked about it more, I explained to him that that other issue couldn't have possibly be causing his fatigue, and we talked more about the exercise and how that was probably playing a role. So when we exercise, we basically have three kind of broad varieties. One we would call the cardiovascular exercise. So when I'm talking about how does exercise reduce stress, today I'm focusing on cardiovascular exercise, and that's as opposed to flexibility or stretching exercise, and as opposed to a strength exercise program. Now, there can be some overlap between a strength and cardiovascular program depending on how you're doing it, but in general, we sort of understand that a cardiovascular program is more like a fast, long walk or a running program or something like that, something that has in the past been called aerobic. Now, because the cardiovascular workouts have evolved to include much more in the elements of what we would call interval training. It's not just pure aerobics anymore, but cardiovascular would still apply. We're trying to get our cardiovascular system into shape, and so the more sustained, even bursts of exercise are what are really helping our heart and our vessels to get into shape. Well, what happens in our brain during that time is fascinating. So there are several things that we could talk about, but I'm just going to focus on three of them today. The first thing is that exercise functions as a distraction from the stress. What I like to call it is it's a mini vacation, and there are a lot of different ways that we can take a mini vacation from our stress, and I teach that in my ongoing courses and books on how to decrease and heal stress. But a mini vacation basically completely takes your mind away from the stress for a while during that day. Many people can't get away for a long vacation. All of us can figure out how to add mini vacations into the day where my mind is completely away from the stressful circumstance. And short periods of time with my mind away from the stress can be very healthy for me in terms of the negative effects of stress on my life. So the exercise program becomes a distraction from my stress. It's a mini vacation. The second thing that it does, and this is fascinating, creates a buffer between me and the experience of stress. Some research was done many years ago comparing uh, student teachers who were uh, in very good shape physically. They'd been in a regular exercise program, and compared them to student teachers who were out of shape. So I think you know the difference between an out of shape and an in shape person. Perhaps you're sort of in the out of shape category right now. This isn't meant as a criticism, just as a point to help you understand the value of exercise. And in this study, they compared the stress response of these teachers to being in different classroom settings. And what they discovered was that people that were physically fit from regular exercise had much less of a stress response in the ways that they could measure. They were doing simple things like blood pressures, heart rate response, and some other things that they could easily measure. And people who were physically fit, it was like there was a buffer between the stressful circumstance in their mind and their body. So the physical fitness itself created a buffer between the mental effect of the stress and what was going on in their body. In both cases, both groups of teachers felt the same anxieties, fears, worries, but how it measured out in their body was different depending on whether they were in good physical fitness or not. So the second thing then that regular exercise does, cardiovascular exercise, is it creates a buffer between what I'm feeling emotionally and the negative effects of that stress on my body. And that buffer is a critical way to help shield your body from the effects of chronic stress. The third thing that we'll talk about real briefly is that regular cardiovascular exercise creates brain chemistry changes during the exercise. And years ago, people used to talk about the so-called runner's high. And people that have any kind of sustained exercise program, they know that they enter into this moment when things feel more peaceful, they feel more relaxed. And that's actually correlating with some significant brain chemistry changes. It's a couple of powerful neurotransmitters, one being the beta endorphins, which are related to pain management chemicals, and serotonin, which is one of the neurotransmitters that modulates how we feel and how happy we are. Both of these and probably others go up with exercise, but they don't go up if you just do something for a couple of minutes. But a sustained exercise time causes this kind of a change in the brain chemistry. So these three different ways are powerful ways that exercise causes my body to manage stress in a way that is more healthy and prevents the stress from having a negative and disease-causing impact. Hope you found this helpful. If you did, please share it with friends and family, and I encourage you to subscribe to this channel to continue to get updates on how to stay healthy and to be able to manage stress in a way that it doesn't hurt you, cause illness, or ultimately kill you. Have a good day. God bless, and we'll talk to you later.